CIDP, Symptoms and Diagnosis. Chapter 1, Chronic Inflammatory Demyelinating Polyneuropathy, CIDP. Chronic Inflammatory Demyelinating Polyneuropathy, or CIDP, is a debilitating autoimmune disease in which the myelin sheaths around peripheral nerve fibers are damaged. If left untreated, this can lead to potentially irreversible nerve damage. CIDP has a worldwide prevalence of up to 9 per 100,000 individuals and is twice as common in men. While it is most common among patients in their 50s, CIDP can affect people of any age. It is a lifelong condition with a pattern of relapses and remissions. Chapter 2, CIDP Mechanism of Disease. At its core, CIDP is a disease of disordered immunity. For reasons unknown, the body's own T cells become activated and extravasate into the tissue. The activated T cells release chemokines and cytokines, bringing macrophages into the tissue, which are primed to attack myelin. T cells are also thought to stimulate B cells through the release of interleukin 4 and 6. These B cells start to produce autoantibodies specific to antigens found on myelin. Once bound, they activate the complement cascade, destroying the myelin sheath. Autoantibodies can also bind to macrophages via Fc receptors, priming even more of them to attack myelin. Ultimately, these various pathways lead to demyelination of nerve fibers and slower signal transduction. It is not known what initiates the cascade of immunologic events that causes this disease. Chapter 3, Diagnosing CIDP. Because there are currently no definitive biomarkers, diagnosis of CIDP is based mainly on symptoms, as well as nerve conduction studies and lab tests. The progressive and symmetrical symptoms of CIDP include both motor and sensory involvement, including proximal and distal muscle weakness, impaired balance, reduced or absent tendon reflexes, paresthesia, and sensory dysfunction. Patients will often report sensory symptoms such as pain, numbness, or tingling sensations, and motor symptoms such as difficulty standing or raising arms, weakness in their arms or legs, and overall fatigue. Nerve conduction studies can reveal slow or reduced nerve signaling, indicating loss of myelin or nerve damage. Other laboratory tests may also be conducted. Symptoms of CIDP develop gradually over several weeks to a few months, while underlying demyelination progresses. Because the underlying pathology of CIDP is ongoing and destructive, early recognition, diagnosis, and treatment may help limit disease progression and prevent permanent disability caused by continued demyelination and axonal loss. The primary demyelination and secondary axonal degeneration found in CIDP result in decreased conduction velocity. For this reason, electrophysiological tests that determine conduction speed are fundamental to the diagnosis of CIDP. CIDP is a progressive debilitating disease that can lead to permanent neuronal damage. If left untreated, CIDP symptoms may progress to severe motor skill impairment and permanent disability. Therefore, early identification and diagnosis of CIDP is important to guide appropriate treatment.